talk about the nurse's role during chest tube insertion. As an ICU nurse, we do place quite a few chest tubes in the ICU. By we, I mean the providers. When I'm working charge, it's one of the calls that I commonly get from the bedside nurse to come assist with. This is a chest tube insertion kit, and while it is not the nurse's role to understand what all of this stuff is because we are not placing the chest tubes, it is your role to understand where to locate that chest tube kit. There are different types of chest tubes, and so familiarize yourself with what is available at your hospital and ask the provider, hey, what type of chest tube kit do you want? When I'm grabbing this kit, I'm also going to grab sterile gloves for the provider. So I will usually ask them what size, and I always grab an extra pair because you don't want to be in a situation where you need to go run out and grab another pair. I'll also grab sterile towels, a sterile gown. I will get the hats for both of us, masks for both of us. Even if you're at the bedside, we are trying to create as sterile of an environment as possible for the chest tube insertion. You are also going to want to grab an atrium as well as suction setup. I also like to grab a bag of emergency supplies as well. If you want a separate video on that, let me know. So your first role is going to be gathering all the equipment. Your next role is going to be asking the provider, hey, do you want any medications for this patient to kind of take the edge off? Sometimes there's lidocaine in these kits, or you may need to grab it separately. Some providers may want to give the patient maybe a little fentanyl, a little Versed. Chest tube insertions can be very uncomfortable for patients. You also are going to assist in positioning the patient however the provider wants the patient positioned. Sometimes patients can be kind of rolled on their side. Sometimes they're actually sitting up. Sometimes you'll see a patient laying back. Just depends on where they want to place that chest tube. You are also going to be responsible for monitoring that patient. So if you are giving them fentanyl, Versed, you're definitely going to want to make sure you're keeping a close eye on their blood pressure as well as their oxygenation. Have all your emergency equipment ready, like your bag valve mask and your suction. Most chest tubes, when they are inserted, are initially on some level of suction. So you should be grabbing, your extra suction canister, some long suction tubing. So that way, when you have the atrium already, you can plug that suction in. Another role is going to be setting up this atrium. The bedside nurse is typically not fully sterile. You're usually wearing a mask, you have your hair back, but you don't necessarily need to be in like full sterile equipment. What is important when you are setting this up is that the end of the chest tube that is going to be connected to the chest tube that is inserted into the patient, that needs to remain sterile. So don't touch the end of this. There's usually like a wrapper over it that you can pull off. And when the provider's ready, you can hand that to them and they can touch it with their sterile gloves. Once the chest tube is in, typically we get an x-ray, and now your role is going to transition over to monitoring the patient. And that is a very general overview of a nurse's role during a chest tube insertion. Let me know if you have any questions.